In this evening's health report, Shamela Pullen looks at sexually transmitted infections, which one expert says are now on the rise.
Local experts are reporting an increase in sexually transmitted infections since the COVID-19 pandemic. Among the most commonly seen in Jamaica, gonorrhea and chlamydia.
So, definitely, when I started last year, it would have probably been maybe one case for the month or one or two for the month. However, within recent times, just in the last 4 to 6 months, it's now 1 to 2 per week.
But this is just in her practice. An STI is an infection that passes from one person to another through sexual contact.
Like gonorrhea and chlamydia, they present very similar in terms of what symptoms you get. Burning on urination, that happens in both men and women. You get this discharge, so vaginal discharge or penile discharge, and that color could be from white, yellow to even green. Okay, and with men, you can even present with testicular pain.
The infections are curable, but if left untreated, will result in long-term complications, including pelvic disease, which can also lead to infertility.
Using condoms, both male and female, once you are sexually active and being sexually monogamous with an uninfected person, and definitely self-testing with your doctor and testing for at least once a year, I will say, just to ensure that you are free from any of these infections. As I said before, some persons may not know they are carrying around the bug because they may be asymptomatic.
Treatment to clear up the infection can be within 24 to 48 hours. Persons are encouraged not to delay in seeking medical attention to prevent complications. With your health report, I'm Shamela Pullen wishing you good health.